that the patient is hypertensive, because in order to diagnose hypertension, as I said before, it depends on the way you are measuring the blood pressure. If you are applying the proper way and you are measuring the blood pressure 5 times, 2 to 3 months, and you find it elevated, this is hypertension. But just to find the blood pressure is high doesn't mean anything. And because of that, if you are depending on this technique, you will find many of our patients treated for hypertension and they are not. Any other question?
We're actually going to continue.
We're going to hold questions now and continue. Thank you very much.
So our next speaker is Dr. Christine Garoya. She is an assistant professor in the Department of Emergency Medicine at Yale University. Her area of focus is non-communicable diseases, and she's going to be speaking on this topic of managing hypertension.
Okay, well, thank you for your patience, everyone, and thank you for coming to our session. So I think that my presentation will tag on nicely to the professor's talk that you heard already, and I'll be addressing more so managing it in the ER. Obviously, sometimes we don't have the availability to repeat blood pressures as outpatients, but we have our colleagues to refer to, so we'll address that. As you heard, my name is Christine Garoya, and my main research area of interest is non-communicable diseases. And so I'm excited to be talking to you about managing hypertensive emergencies in the emergency department. So we'll have a brief background on the importance of the disease in Africa. We'll also talk about how you define hypertension. I think I heard that question in the ED setting with our availability of resources. We'll talk about the workup, management, and then how to disposition the patients. So why is hypertension so important in Africa? The WHO estimates that about 1/3, or 1 out of 3 individuals, adults in Africa actually have it because our quality of evidence is somewhat limited in this area. It's also attributed to cause around 1 million deaths per year, just in Africa alone. And it's the lead risk factor for cardiovascular disease, which, as we heard from our colleague from the Ministry of Health this morning, is actually a growing burden on the continent. And it's not only a concern for mortality, but also morbidity is an issue associated with high blood pressure. So actually 4% of disability-adjusted life years or quality life years are lost associated with just hypertension alone. And it's actually the 7th leading cause. I was actually interested to see this. Only second or after hygiene and sanitation-associated issues. And the main issue in Africa specifically is that we not only have a lack of awareness of the disease, and a lack of appreciation for the importance of the disease, but we also have lack of access to treatment, and then in those patients that do get treatment, there's also lack of control, so follow-up and compliance with medications and so on. And so this slide is actually from the Global Burden of Disease Study, results from 2015. As you can see, not only is prevalence of disease concerning in all regions of the continent, but also there's an upward trend in all the nations. So I've taken examples from Northern Africa. This is from Egypt, and then from East and Southern Africa. This is South Africa, which is obviously, as we know, upper middle income, so their prevalence is a bit higher, but Zimbabwe, which is representative of the Southern African region, also shows that, again, it's uptrending in all nations. And this dip is probably associated with HIV and AIDS being the predominant lead cause of death in South Africa, but again, we're seeing that hypertension is prevailing. So how do we define high blood pressure? These numbers are taken from a consolidation of a few different sources. So you've all probably heard of the AFM handbook. Everyone's heard of the AFM handbook, I heard? I hope. Yeah, okay, good. So which I think is what most of the trainees now coming up in our region are going to be set to standards for. And then also from... I'd like to ask some hypertensive lady if she's pregnant. Don't know? Preeclampsia, very good. Okay, good. So I just wanted to bring that up. I'm not going to go into depth about it. There's a lecture, I think, on the 3rd day about obstetric emergencies, but just to note. And then medication-wise, also want to ask, sometimes patients don't know that they're on medications for hypertension, and you look through or you see a diabetes pill or something else that could be associated with hypertension, so checking that's important. Asking about their family. They have a family history of high blood pressure, cardiovascular disease, associated illness. Also important to ask about drug use. So stimulants, cocaine especially, can also trigger severe hypertensive illness. And alcohol, specifically in the case of alcohol withdrawal, can be a presentation for elevated blood pressure. And then specifically on your review of systems, your history, you want to focus on questions to do with obviously cardiac, lung, and neurologic, asking about chest pain, difficulty breathing, neurological symptoms, and then also just remembering that ischemic heart disease, that's IHD, and dissection can present solely with back pain or also with abdominal pain. So things to think about when you're talking to your patients. In terms of the physical exam then, again, just by system, when you're thinking about stroke, you want to ask about altered mental status, confusion, speech changes, any focal symptoms associated with deficit sensation changes, and you want to do a full neurological exam, cranial nerves, motor strength, sensation, etc. Then for your heart exam, you might hear a murmur or a gallop, especially in heart failure. You might hear an arrhythmia. The patient could present in shock. Other maneuvers you can check for with heart failure include jugular venous distension, hepatojugular reflux. If it's severe end stage, they can develop organomegaly. Obviously, in this setting, organomegaly may be signs of other things like TB, but if somebody is presenting with symptoms not consistent with infectious symptoms, something to think about is